welcome to this program series on HIV and family education. We have already brought to you several video programs related to this course. And the main objective of this particular video program is to promote and provide an understanding about the concept of palliative care, especially for persons living with HIV/AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS has become one of the most serious health problems in India. AIDS is caused by human immunodeficiency virus, and this virus might live in human body for as much as 5 to 8 years before actual symptoms appear. HIV makes the body weak and makes it less able to fight sickness. People with HIV in their body go on to become sick with full-blown AIDS. Earlier we used to say the proverb that prevention is better than cure. But in case of HIV/AIDS, since there is no cure available, we have to prevent it under any cost. In India, AIDS has actually become a community problem because AIDS patients are often shunned out. They are hounded out of their homes by their families, in-laws, neighbors and friends. They are sometimes denied the basic health care. And after death also, they are not spared. Their bodies are at times discarded and their families are denied the rights of performing the last rites. Palliative care for HIV/AIDS combines the professionalism of an interdisciplinary team, including the patient and the family. It is actually provided in the hospitals, hospices and at the community level when the patients are living at home. Professor Gracious Thomas further elaborates on that.
We all know that HIV/AIDS is a disease which does not have any cure at the moment. We also know that every day hundreds and thousands of new cases of HIV is emerging in our country. Now, because this is a disease which has no cure available, once people cross the incubation period, they will start developing AIDS defining illnesses. And we have hundreds of thousands of people across the country who needs to be taken care of at this particular stage. Our healthcare system in the country is not equipped with adequate facilities to take care of the growing needs of the AIDS patients. Because of this, a time has come for us to educate our people, give them adequate information about the what, why and how of palliative care, so that our patients are able to get adequate care and support within their own family setup and the community.
There are people living with HIV in every part of India. We encounter them from every walk of life. They are living as best as they can, faced not only by illnesses but also by the emotional stress, economic crisis, and most of all, social stigmas and discrimination. We often consider ourselves as sympathetic, gentle and tolerant individuals. Yet, most of the times we fail to reach out and hold hands of those people who are in need. Persons living with HIV/AIDS require personal care, symptom control, emotional support, financial and legal planning, and nutritional care. Palliative care is the combination of active and compassionate therapies intended to comfort and support individuals and families who are living with life-threatening illnesses. Over the last few years, a few specialized programs have been developed by NGOs and missionaries to create resources for the persons living with HIV/AIDS in India. We have met Dr. Suniti Solomon, who was one of the team members that detected the first case of HIV in India. We have an interview with Dr. Suniti Solomon.
I was working at the Madras Medical College as professor of microbiology, and we used to get students for post-graduation. And so I asked one of the girls to take up HIV as her project. There's a lot of difficulty. She said, no, we don't have men having sex with men in India. So I said, okay, let's look at the women in prostitution. So we started collecting samples, and then we didn't have kits for testing the HIV. So my postgraduate took the samples and went to CMC Vellore for a test. And at 9 o'clock in the night on March 2nd, I got a telephone call and I couldn't believe what I heard on the phone. It said 6 women samples are HIV positive. I said, look, you must have made a mistake. It cannot be true. 6 out of 100. So I said, please repeat the test again. So they repeated the tests, and then next morning again I got the call saying the same 6 have come positive. ICMR did not believe it. The government of India said we made a mistake. So the same samples were sent to US to Tom Quinn's lab, and there it was tested for Western blot, and they all came back as positive. And that was the first time it was announced in the Parliament in April of 1986 that HIV had set foot into India. And there was a lot of denial. And today, after 16 years of the disease being around, still there is denial. I used to see 1 case a week at those years, but today I see minimum 5 to 6 new patients every day. And that is how much the virus has spread. And we in India still have a strong denial.
Palliative care is administered by a group of people who are working as a team. In practice, the team consists of doctors, nurses, physiotherapists, occupational therapists, social workers, counselors, community medicine personnel, nutritional expert, family members and NGOs. Above all, coordination is an important component of teamwork. Here, the challenge is to handle conflicts and overlap of roles constructively and creatively. Remember, partnership among the caring team is very important. The patient and the family should sit together and work out all the details to avoid misunderstanding. Partnership requires mutual respect as well.
Palliative care essentially is teamwork, because you have to have doctors, nurses, volunteers, psychologists, and volunteers are very essential to a teamwork like this. Since we are dealing with the total and active care of the patient, everyone has a role to play. Volunteers also, and social workers, people, maybe the public too, for rehabilitation of the patient. So this is absolutely essential to have teamwork and to be able to work together.
Psychosocial needs play a vital role in palliative care for HIV/AIDS. Depression, anxiety, social stigma and fear of death are certain common symptoms in HIV/AIDS patients. Psychological support includes voluntary counseling, spiritual support and also help to prepare for eventual death. We have met experienced doctors in this field of psychosocial needs. Let us speak to Reverend Father Thomas Kalam and Professor Suniti Solomon and learn more about this.
Every pain is difficult for human beings to handle, but the pain associated with HIV/AIDS is much more difficult to handle because of the stigma attached to this disease. AIDS is a disease caused by a dangerous virus, but people, especially in our country, tend to look at AIDS patients as bad people, sinners, criminals, and that adds to their pain. The most important thing is to deal with AIDS patients as wonderful human beings like any of us. Any human being can contract AIDS in different ways, and our obligation to patients is to take care of them, not to judge them. Nobody can judge anybody else. All of us are in the same boat. Some of us are unfortunate enough to contract AIDS. Therefore, the primary need is to restore the self-esteem of AIDS patients and enable them to fight this disease positively.
HIV is a stigmatized disease. So if you talk of the HIV pandemic, I'm more worried about the pandemic of stigma, because HIV was first detected among the gay community in US, and then in our community it was among women in prostitution. So anyone with HIV naturally has a lot of stigma attached to it. So the minute somebody is diagnosed as HIV positive, the first thought which comes to them is they should commit suicide because of the stigma attached. or the other extreme is they want to talk about HIV and spread it to as many people. That's known as vengeance. And this feeling of stigma and discrimination is so strong with HIV as it was with leprosy 2000 years ago, and that is the need for psychosocial counseling today. If you think medicines are important for HIV, I would say 50% of the treatment for HIV is psychosocial counseling, because a person who comes to us crying, we want them to go out smiling, and that is possible with proper type of counseling.
Always remember, never lie to a patient. The doctor-patient relationship is founded on trust. As a caregiver, we should hope for the best but prepare for the worst.
Counseling has never been part of the healthcare in India. If somebody is dying even of cancer, we never tell them they're going to die. They'll say, it will become all right, you'll be all right, don't worry, we'll take care. You know, that is what we've been doing for healthcare in India. Now, once HIV came in, and because of the stigma attached to it, we need to talk to them. For example, if somebody comes with for a test, and you ask them sensitive questions, for example, have you had more than one sexual partners? When was your last sex? Have you used condom? You know, there's a lot of hesitation in talking. So how many people do you think in India would freely talk about sex to you? So counseling is not as easy as people think it is. The other important thing, counseling is just not for the patient alone in India. For example, if a person comes here with HIV and we counsel them, next we want to talk to his wife, because the virus spreads through sex to his wife. So the wife has to be counseled, and that's known as coupled counseling. For many times the spouse will not be brought because of the stigma attached to it again. Then once you talk to the husband and wife, usually the wife or the husband will want the family to know. So we do what is known as family counseling. So counseling is a difficult process, but it has to be adhered to in HIV if you want a success in management of people with HIV.
Pain is quite common in HIV/AIDS cases. Pain increases gradually at different stages of infection, especially hospitalized patients and ambulatory AIDS patients also. Pain may be caused by the disease itself, or by the side effects of the treatment, or due to disability or any other unrelated condition. The best form of palliative therapy for pain is the symptomatic treatment of pain. Management of pain. Often, pain is an underrated and undertreated problem in the patients with advanced stages of HIV disease. Step 1. For mild pain, use non-opiate analgesics. For example, paracetamol, ibuprofen and acetaminophen, etc. Step 2. Moderate pain. If non-opiate fail to relieve pain, then use a weak opioid. For example, codeine and propexifene. Step 3. Severe pain. When non-opiate or weak opiate fail to relieve pain, then use a strong opiate which is used, for example, morphine, methadone and pethidine. In palliative care for HIV/AIDS, it is very important to know what and where the problem lies. If the patient complains of a particular symptom, we should be able to say how best we can ease out the problem. We have tried to show you some important checklist of regular examinations. This information will be useful to you as a healthcare provider, especially to doctors, to nurses and other healthcare providers. Now here is a checklist for regular examinations.
HIV infected people develop pain in the feet and also numbness in the legs. This condition we call it as peripheral neuropathy. It can be due to the virus affecting these nerve cells. Also some of the drugs what we use in TB, tuberculosis, as well as some of the drugs to treat the virus called stavudine can also produce this type of peripheral neuropathy.
Symptom: abdominal pain. Important conditions to consider: gastritis or esophagitis, acalculous cholecystitis, colitis, intra-abdominal malignancy, enteric pathogens. Symptoms: skin rash.
So this condition is called herpes zoster. Is the most common problem we see in HIV infected people in the skin. This is caused by a virus called varicella zoster, which produces chicken pox. In HIV infected people, this virus can reactivate from the dormant state and producing this type of skin lesions, and it can be treated with a drug called acyclovir. So this condition is called eosinophilic folliculitis or papillopruritic erection. HIV virus can infect a cell in the skin called Langerhans cell, producing this type of itchy papillary rashes, and patients will have severe itching, and again it's very difficult to treat. When we start the drugs to control the virus, we call it as antiretroviral drugs, these lesions disappear. So this condition is called molluscum contagiosum, caused by a virus called pox virus, which produces this type of nodules. It can be in the face, it can be in the skin, anywhere. And again, it's very difficult to treat because the chance of recurrence is again high. We treat this with a technique called cryotherapy. This condition is called Kaposi sarcoma, which is one of the common cancers people used to see in HIV infected people in the United States and in Europe and in Africa, but this is not common in our country, and patients can also develop skin nodules in the face, in the mouth, in the eye, sometimes in the genital, leg, the back, anywhere, and this is not common in our country, and the occurrence of Kaposi is very closely linked with the occurrence of another virus called human herpes virus 8.
Symptom: difficulty in swallowing.
This condition is called oral pharyngeal candidiasis, caused by a fungus called Candida albicans, and patients will develop distaste and also have difficulty in swallowing, and this infection can also cause lesions in the angle of the mouth, which we call it as angular cheilitis. If it is left untreated, it can produce infections in the food pipe, in the esophagus. This condition we call it as esophageal candidiasis, and people will have difficulty in swallowing. This can be treated with a drug called fluconazole. The chance of recurrence is more, hence we may have to treat again and again. Ulcers in the mouth are very common in HIV infected people. It can be because of variety of reasons. It can be due to certain viruses or due to certain bacteria, or HIV itself can produce. So this condition is called herpes simplex lesions in the mouth. It's been very painful, and it can be treated with a drug called acyclovir. Also in HIV infected people, HIV virus itself can produce this type of ulcers. We call it as aphthous ulcers. Very painful, again very hard to treat this.
Symptom: cough.
Tuberculosis is the most common opportunistic infection we see in HIV infected people, and it can cause problem in the lung as well as in other organs, and patient will have cough, fever and loss of appetite, and they also bring out sputum, phlegm out. Sometimes it can also contain blood, and this condition can be treated with a standard TB drugs. And TB can also manifest in different ways, and patients can also develop glands in the neck. Here this X-ray shows lymph node enlargement in the neck because of TB infections. Also this TB can also occur in other organs like in brain, in the glands as shown in this slide, as well as it can produce abscess as been shown here, and also it can cause lesions in the liver, in the spleen, in the kidneys, and also in all organs in the abdomen. PCP pneumonia is a common problem in people who have got very low CD4 count. When the count is less than 200, they tend to develop, and this is caused by a parasite called Pneumocystis carinii, which is a parasite which can spread in the air from one person to another. The normal people usually don't develop the disease. When the people who got low immunity, like in HIV infected people, are prone to develop this pneumonia, then this X-ray which shows is PCP pneumonia, and this organism can be demonstrated by a special immunofluorescent stain, and it can be viewed through a microscopy. And this pneumonia responds well to a drug called cotrimoxazole with supportive oxygen and steroids. If you don't start the treatment at the appropriate time, you lose the patient. So this condition is called PCP pneumonia.
Symptom: change in mental state.
HIV infected people can also develop infections in the brain and producing opportunistic infection. We call it neuro-opportunistic infection. The most common being cryptococcal meningitis, caused by a fungus called cryptococcal neoformans. This slide shows this cryptococcal neoformans. These organisms can be demonstrated in the cerebrospinal fluid by stained with a special stain called India ink, and this condition has to be treated with a drug called amphotericin B. This slide showing CT scan of HIV infected people with multiple abscess because of an organism called Toxoplasma gondii, which produces infections in the brain. This condition is called toxoplasmosis. when patients can have headache, vomiting, sometimes fits, that's convulsions, and this can be easily diagnosed and can be treated with a drug called sulfadiazine and pyrimethamine. This condition can be prevented by giving a drug called cotrimoxazole. This drug we usually give to patients with less than 200 CD4 count to prevent PCP pneumonia. This drug is also act like a prophylactic drug to prevent toxoplasmosis. So this condition is an MRI scan of a patient, HIV positive patient, showing white matter lesion. This condition is called PML, progressive multifocal leukoencephalopathy, caused by a virus called JC virus, which produces paralysis. This CT scan is taken in a patient who's been HIV positive and is called dementia. Dementia is another common problem we see in HIV infected people whose CD4 are low, and HIV can cause destruction to certain cells in the brain called glial cells. As a result, the brain can shrink. We call this condition as cerebral atrophy, and as a result, patients tend to have memory loss. It's what is called AIDS dementia complex.
Symptom: change in vision.
This viral condition in the brain, in the eye, this we call it as cytomegalovirus retinitis. So this virus produces infections in the retina, and as a result, patients can develop blurring vision and sometimes blindness. It has to be treated with a drug called ganciclovir.
Symptom: diarrhea.
Prone to develop diarrhea. In fact, 30% of the patients in the lifetime they develop chronic diarrhea. So these are the common causes for diarrhea, the most common being Cryptosporidium parvum, which is caused to be a parasite which spreads from one person to another person through contaminated drinking water. Again, very difficult to treat. The other common organisms are Angiospermol duodenale, Ascaris, Cyclospora, Trichuris, Microsporidium, and of course cytomegalovirus can also produce infections in the colon producing diarrhea.
Some common symptoms and their relief method. Persons living with HIV/AIDS have to be very careful with every common ailment. AIDS patients have to take extra care with mundane activities and daily routine like personal hygiene, water they drink, air they breathe, and food they eat. They have to take care with fever, chills, nausea, vomiting, diarrhea, wasting, constipation, acidity and heartburn, shortness of breath, insomnia, mouth and throat infections. These are very common symptoms in HIV/AIDS. We have demonstrated the relief methods for each symptom. We have also given nutritional advice. For example, we have suggested food items to be taken and the food items which are not to be taken for each symptoms. Now, let us watch step by step. Here are some relief methods for fevers and chills. Keep the room well ventilated. Record the temperatures at regular intervals. If very high temperatures, then sponge out the patient's body with tepid water. Fever may last for few days. If the patient is shivering, cover with extra blankets which can be removed when the fever goes down. Ask the doctor to prescribe an antipyretic to bring down the fever. Nausea and vomiting caused due to the pressure on the stomach may cause nausea from the blocked intestine or from a sensitive stomach or constipation, and even due to anxiety. Here are certain relief methods for nausea and vomiting. A cloth soaked in cool water on the forehead and slow deep breathing exercises may help to alleviate nausea. Make the patient sit up for at least an hour after eating or drinking. Antiemetics may need to be given orally at least 30 minutes before feeding. If that does not work, then medication might be needed to be given to the patient either by injection or even rectally. The best way to get relief from vomiting is to make the patient rinse out the mouth with water to which a teaspoon of salt has been added. This will not only remove the taste of vomits but will also cleanse the mouth of acids and enzymes of stomach. Keep the kidney bowl or tray handy at all the times.
People who have nausea and vomiting should be given slightly salty foods and slightly sour foods, like for example advisable to keep rock salt in the mouth, so that salty taste of that food will help to alleviate the nausea feeling. And even the lime, we all know that a drop of this lemon juice, which is very sour, which can be placed in the tongue, can alleviate this nausea.
Here are certain relief methods for diarrhea. After each bowel movement, clean the patient thoroughly with water, dry well and apply a Vaseline to prevent skin breakdown. Sometimes the diarrhea may be foul smelling. Be sensitive to patient's embarrassment. Do not make a bit of issue of it. Just use room fresheners.
For diarrhea, we have to find out what is the cause of the diarrhea also, because some of the people will not be able to tolerate milk products. So if they are not able to tolerate milk products, then it is better to avoid milk. Most of the people will be able to tolerate milk. In that case, milk is a good source of protein, so milk can be given. High fiber foods should not be given, that is the insoluble fiber and very hard foods, like for example chapati, and then vegetables which contain a lot of fiber. All these should be avoided in people who have diarrhea.
Wasting is a common symptom for a person living with HIV/AIDS. He or she will lose up to 20% of their body weight, leading to repeated injections and progressive deterioration.
People suffering from wasting have to be given a very high protein diet, and a moderate amount of fat can be given. High protein foods means you can give them a lot of sprouted legumes like sprouted green gram dal, sprouted Bengal gram dal, green peas. All these can be sprouted. When it sprouts, the vitamin content increases by about 6 times more than the ordinary legumes.
Constipation is one of the symptoms for HIV/AIDS. Tuberculosis of intestinal tract, low fluid intake or stress may cause a blockage of bowel movement. Encourage the patient to exercise, even if only in bed.
So for constipation, you have to take a high fiber diet, that is a lot of fruits and vegetables with the skin and with the fiber part of it, so that this will help in easy bowel movement. It will push the food through the gastrointestinal tract and prevent constipation. Also, it is essential to give people some good liquid in the morning, so that will also help in the bowel movement regularly.
The causes of acidity and heartburns are sometimes due to side effect of medicines.
People with acidity, till the acidity subsides, it's better for them to take very liquid and solid foods, like which are also very rich in nutrients, like milk is a very good nutrient supplement. Then the Shaktiban, which is made into a porridge, is very good. Rice and dal together made into a soft kanji is very good for acidity. And main foods that should be avoided is acid foods, fruits like mosambi or lemon juice can be avoided, and also tea, coffee should be completely avoided, as also spicy food. Any kind of chilies or pepper should be completely avoided.
Breathlessness or shortness in breath can occur with illnesses such as pneumocystis carni, pneumonia, other pneumonias, lung tumors, excessive secretions in the lungs, asthma, weakness, and even due to anxiety. Let the patient rest in a well-ventilated room in their most comfortable position, supported by pillows if required, with the arms raised for maximum lung expansion, and breathe deeply, inhaling through the nose and exhaling through the mouth. This should be done before and after every activity, including eating. Here are certain relief measures for a common problem such as insomnia, psychological and spiritual problems. The patient may have difficulty in sleeping. This problem is commonly known as insomnia. Sometimes the patients may sleep throughout the day and stay awake all the night, thus causing stress to the caregiver. Do not force the patient to sleep as per your wish. Let the patient relax and watch television, listen to the music of his choice, or read newspaper or whatever he wishes to read. Avoid caffeinated drinks. Warm milk sometimes work as a good sedative. Here are certain measures to counter the problem of bed sores. The commonest sites for bed sores are back, hips and shoulders. The first sign of bed sore is redness and burning of the skin. The dressing should always be kept clean and dry, and it should be done once a day after a thorough wash with potassium permanganate or hydrogen peroxide. Relief measures for mouth and throat ulcers due to side effects of medication or dehydration makes a patient eating painful. Read instructions carefully and consult doctor before giving any rinsing solution to patients, because rinsing solutions are of two types, swallowing type and spitting type. You can also make a homemade rinsing solution. Mix 1 cup of water with 1 tablespoon of baking soda or salt, and the rinsing solution is ready. Before we end this program, let us briefly recapitulate as to what we have explained in this program. We have explained the concept of palliative care for AIDS patients and also its essential components. We have also explained the management of pain and relief of symptoms in terminal AIDS disease. Remember, all these issues are better understood only when you have the practical experience with the patient. And one more tip, it is always easier said than done. Kindly go through the print material on the basic course on HIV/AIDS, and that is block 2 units, first and second, along with the prescribed units on palliative care. We'll come back to you with similar kind of programs. Till then, goodbye and namaskar.